Okay, so my talk tonight is a new way to look at obesity. You know, we often look at obesity as a medical condition. That was the American Medical Association a couple of years ago declared obesity as a disease. Um, and so that's the big hot topic in America right now is obesity as a disease. And the reason why is because obesity um, leads to other comorbidities, right? It leads to diabetes, high blood pressure, arthritis, sleep apnea. Who here loves their sleep apnea, their CPAP machine? Raise your hand. Do you love your CPAP machine? Yesterday was Valentine's Day. Did you get your groove on with your CPAP machine running? I mean, most likely not. So it's all the hot rage right now to talk about obesity as a disease, but I want to talk about obesity in a different way. Okay, now we know that obesity is a major problem right now, but here's tip number one. If you're taking notes, write this down. Okay, tip number one: um, a problem is really two problems. Think about that for a second. A problem is really two problems. It's two ends of a stick. Or another way I want you to think about it, it's two sides of the same coin. All right? It's two sides of the same coin. That's it. It's not a single problem. And if you think of obesity that way, then the solution to obesity is very simple, right? Isn't that the truth? If you think that obesity is just a disease, then you're like, holy shit, it's a disease. I got nothing. It's out of my control. I can't do anything about it. I have to go see the doctor. He's going to put me on some pills or a diet or something. And that's not the truth at all. Obesity is a two-sided coin. There are two sides to every problem. So that's the first tip that you want to think about obesity. All right. Now, if you think about it, like I'm a weight loss surgeon, so a lot of my patients are looking forward to having their weight loss surgery. Isn't that true? You're looking forward to your weight loss surgery. And so you're thinking, Dr. Vuong, just do my surgery. Just do my surgery and I'll feel better. And my diabetes will go away. Well, it's two sides. Everybody wants the surgery. Let's say this side of the coin is surgery. The other side of the coin is what? Not having surgery. So you think just because you come to my seminar means you're going to have surgery? Answer is no. There's still the option that you don't get the surgery. Does that make sense? If you, there are patients who get their insurance approved for surgery, and they have a surgery date, getting ready for surgery, and they'll decide, guess what? Not to have the surgery. Does that make sense? They'll decide it's not the right time. They'll drop out. So there's no guarantee, right? So people say, well, Dr. Vuong, if you'll just do the surgery on me, I won't have diabetes anymore. Well, that might be true, but remember the other side of diabetes is what? Not having diabetes is also having diabetes, And you have to do the things, here's tip number two. Since it's a two-sided coin, you have to do the things that's going to give you the results you want. So if you want to lose weight, you have to do the things that's going to help you lose weight. Because if you don't, then you won't lose weight because it's the same problem. Does that make sense? Maybe I'm not describing it well. But people can't sit there and say, well, Dr. Vuong, I want to lose weight, but I want to keep eating pizza and junk food and drinking sodas. Well, no, baby, that's the other side of the coin. Does that make sense? Like if you want junk food and pizza and Xbox and sit on the couch, that's obesity. You're voting for obesity. So if you want to lose weight, you got to do all the opposite stuff on the other side of the coin. That's it. Because it's the same problem. And that's the solution to it. A simple way of looking at it. If you don't want diabetes anymore, you can't eat sugary stuff. You can't eat simple carbs. You can't eat bread because that's a vote for diabetes. If you don't want diabetes, that's the other side of the coin. So stop doing that stuff. And there's no other way around it. I know it's not genius, but there's no other way around it. People say, no, I want to eat sweets and junk and not have diabetes. Well, it doesn't work that way. You might say, well, I don't want my sleep apnea anymore. Well, then you got to lose the weight. You have to use your CPAP machine. You're like, Dr. Vuong, I'm tired all day. I'm sleepy all day, but I don't want to use my CPAP machine. Well, that doesn't work. You have to take things as a step-by-step process, you know? Um, and that's really it. That's my talk for tonight. You got to look at obesity and health and wellness as a two-sided coin. You can think of one side of obesity, one side is obesity, the other side of the coin is health and wellness. Now, which one do you want to focus on? Which one do you want to choose? They each have different behaviors. One behavior is going to lead to obesity. The other behavior, the opposite, and it's usually the opposite behaviors, is going to lead to health and wellness. And that's it. You know, if you're going to eat fresh fruits and veggies most of the time, you're going to get health and wellness. If you decide to go for a walk at the end of the day instead of flopping on the couch, you're going to get health and wellness. But if you want to drink sodas every time you go out to a restaurant and say, oh, but Dr. Vuong's diet soda, no, that's a vote for obesity. And you can't get around that. People say, no, I want, because here's what people think. They think, I want to eat junk and lose weight, like it's two coins. It's two problems. Like, no, it's the same problem. Does that make sense? Every problem is two problems. It's two ends of a stick. You have a stick, you have one end and another end. Coin has two sides. I want you to focus on the side that you want in your life. That's what you have to do. And there's no way to get around that. All right? That's my short and sweet. Thank you guys.